Pay attention. Time now for Sunday House Call. Joining us this morning is Dr. David Samadi, Chairman of Urology at Lenox Hill Hospital. Congratulations on your new move. And Chief of Robotic Surgery.
And Dr. Mark Siegel, he's the Associate Professor of Medicine at NYU's Langone Medical Center and the author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health. Doctors, great to see you as always.
Good morning. Good morning.
We start with this stunning study. Have you heard about this? It has to do with fish oil and fish oil supplements for men. You know, a million of us take omega-3 fatty acids for our health and other benefits. They say it's good for our heart. But some new research this past week shows that it could potentially raise the risk of prostate cancer by more than 70%. Who better to tell us about that than Dr. Samadi, who knows all about prostates? I mean, are you kidding me? They tell us this stuff is great. You take it every morning for your heart, and now it's going to potentially increase your risk for prostate cancer?
Yeah, this was a shocking news, and we got so many emails about this, and there's a lot of confusion that's going on, so we want to clarify this. This particular study that was published in Journal of National Cancer Institute talks about, and it wasn't designed, this particular study, to find out if the fish oil causes prostate cancer. This was an incidental association that was found in this, so we've got to be very careful about this. Part of the SELECT study that looked at vitamin E, if you recall, a few months ago we talked about vitamin E that can increase the risk of prostate cancer by 17%. Now they're finding the same thing with omega-3 fatty acids. So where do I stand? Because I want to answer all those folks that emailed me. I think omega-3 fatty acid is still an excellent choice for heart, for Alzheimer, also for children, for brain development. But you got to be careful about how much you take. There's a whole culture in America about this Hollywood supplements and vitamins, and if she takes it, I want to take more, and Mark wants to take more than I do. That's a mistake. These supplements should be treated as medications, even though there is no prescription. But when you take them, especially at the high level of fish oil, which is what this study is about, you can change the physiology. At the normal dose, it can protect you. It can reduce inflammation. It can help you with cancer and diabetes at high dose. So what is high dose?
When you say a normal and high, what should we do?
So that's excellent. You should not be taking more than 3 grams a day, which I think is still very high. That's the recommendation. But let me just tell you that the finding in this study was that the difference between low dose and high dose was only 2 portions of salmon. That's it. So what I recommend people is, you know, balanced diet is the best thing. If you don't have to take supplements and you have balanced diet, that's fine. 2 portions of salmon a week is perfectly fine. The issue...
What if you have more?
So this is what happens. What people do is they take their salmon 3-4 times a week. Then they take their chia seed that has also omega-3 fatty acid, flaxseed. They take omega-3 fatty acid. And now all of a sudden you have a very high dose of omega-3 fatty acid that can cause a problem. That's what this is about. So you want to make sure you talk to your doctor, find out what the level is before you really take too much.
So Mark, what do I do? How much do you take? Right? Look, you see the fish oil on the shelf. It's like 1,200 milligrams. I mean, how much do you take, and what do you do?
A couple of points. First of all, this is the 3rd study now that's shown an association between omega-3 fatty acids and prostate cancer. The last 2 showed with high grade. This is the first one that shows an association, Eric, with low-grade prostate cancer. So it's starting to look more and more suspicious, even though we tend to look at inflammation as causing cancer, and this is confusing because omega-3s are low in inflammation. And even the study author himself said to me, I don't even know why I'm finding this, but it could be that they're metabolically active. And David was saying this the other day on TV. They're metabolically active chemicals, and they break down a lot, and they may actually somehow lead to prostate cancer. We don't know why yet. Now, in terms of what to take, Eric, I want to make a really important point here. There's fish on the one hand, and there's supplements on the other. You may be eating fish to protect yourself against eating a cheeseburger. In other words, you might eat fish because we say it's part of a Mediterranean diet and it's healthy. That's not the same thing as taking supplements. This study showed, and we have a statement from the study author, Alan Crystal. Let's hear what he had to say about how much you're supposed to actually eat. The study was for any source of long-chain omega-3 fatty acids, so that those that are high in fish consumption, supplements use, would take 3 to 4 servings of fish per week to get into the highest group. And exposure for omega-3 supplements, even once every 3rd day, would put you in the highest group. So in other words, David was already saying this, 3 to 4 portions of fish a week or more could be problematic. With supplements, if you take the supplements twice a week. So why would anyone need the supplements that are at risk for prostate cancer? I say no, no supplements.
Okay, but 1 second, because I know this is about men, but you pretty much call down what I eat. You must be in my house, in my cupboard, because it's the salmon, it's the fish oil, it's the flaxseed. So is this a problem for women?
I think right now the discussion is all about prostate cancer. Obviously, that's the important part. But don't overdo it. The more is not better. Now, there's something that I want people to know. There's also omega-3 fatty acid index. And you can ask your doctor to draw your blood and find out if your level of DHA and EPA, you want to write this down, Eric? This is the time that everyone is taking notes, is whether it's too high or not, and that's how you adjust it. So what I want people to know is treat every one of those portions of salmon almost like 1,000 milligrams. And so if you're getting 2 portions plus once or twice of supplements, that's more than enough. But individualized medicine is the way to go. To go to a store and pick up these big bottles of fish oil, and because your neighbor is taking it, you should be taking it.
No, I don't. It's not about a competition.
That's bad
don't
medicine.
overdo
Not
it.
about you, but in general, people think that taking supplements is a great thing for us.
And you made a good point. It's about men and prostate cancer we're talking about here. And there's a growing body of evidence that there's an association between omega-3 and prostate cancer.
One last thing, because I know we're running out of time, but if you have had radical prostatectomy and your prostate is removed, you're okay to take fish oil, but still talk to your doctor. That question came up.
It's really, really, really important. And